I bring you greetings from South Africa. I would like to thank Pfizer for inviting me. I was part of this study that was done. It was a multi-center study. The main author, obviously, was Professor Ari Zimran from Israel, and I was the third author. The title of the study and the paper was The Long-Term Safety and Efficacy of Taliglucerase Alfa in Pediatric Patients with Gaucher disease. We looked at patients who were both treatment-naive and those who were previously treated with Imiglucerase. I'm a pediatrician. I'm based in the University of Witwatersrand in Johannesburg, South Africa. Can you hear me? Okay, just in terms of an introduction, Gaucher disease during childhood, we know, is usually associated with more severe disease manifestations and a much more rapid disease course. There's obviously a greater overall disease burden, and we know that enzyme replacement therapy is recommended for children with Gaucher disease. We also know that early treatment may decrease the risk for irreversible pathology. Just a reminder of what Gaucher disease is. It's a lysosomal storage disorder. It's inherited in the autosomal recessive fashion, and what happens is actually there's a deficiency of the enzyme glucocerebrosidase, and what happens is there's lipid-laden macrophages that are deposited in the liver, spleen, bone marrow, and even the brain. Taliglucerase Alfa, the other name obviously Eleliso, was approved for adults with type 1 Gaucher disease in multiple countries. Unfortunately, in South Africa, it hasn't been registered yet. It's also approved for pediatric patients with type 1 Gaucher disease in the United States, Australia, Canada, and Israel. And it's also used for patients with type 3 Gaucher disease in Canada who have hematological manifestations. I'll just remind us of what the different types are. Type 1 is basically the non-neuronopathic. The type 2 and type 3 is the neuronopathic Gaucher disease. It's the first approved plant cell express recombinant therapeutic protein, and it's produced in disposable bioreactors as you see there, and it's free from mammalian components. The objective of the study was actually to assess the long-term safety and efficacy of taliglucerase in the pediatric patient populations with Gaucher disease. And we had two arms. We had the switch-over arm, those who were previously treated with imiglucerase or Cerezyme, and the treatment-naive patients. And it was, as I said, it was a phase 3 multi-center extensional trial that assessed the safety of taliglucerase. And the inclusion criteria was, as I said, pediatric patients who successfully completed 9 months of treatment with Taliglucerase Alfa and who had previously had Cerezyme. And then they had those who had completed 12 months of treatment with Taliglucerase Alfa in the study PB0605 in the treatment-naive patients. And what were the main exclusion criteria? If they were taking another experimental medication, obviously, if they had any features of type 2 or type 3 disease with severe neurological symptoms, any other medical condition that would interfere with participation in the study. And the dosing for the switch study, the PB06002, we used the same dose as that was treated with imiglucerase. And in the treatment-naive patients, the PB06005, we used Taliglucerase Alfa either 30 units per kg or 60 units per kg. And this is just a flow diagram of what we looked at. As PB05002 were those patients who were switched, and there were 5 of them. We looked at them for 9 months, and the naive patients, the PB00605, were the naive patients. We looked at them for 12 months, and then we went on to look again after the 12 months for another 24 months. And out of the naive patients, if you look in the bottom column, one of them was not enrolled because basically they had the type 3 disease, and they also had cardiac abnormalities which excluded them. And in terms of the patient demographics, this is obviously interesting. The age, the mean in the treatment-naive, the ones with the lower dose, 30 units, the mean was 8.6. and the higher dose was 6.6. And obviously the switch over, where they had obviously been on imiglucerase, they were slightly older. And the median, you can see ranges between, in the first column, 3 to 13, and the ranges, and 60 units, 2 to 10, and then the switch over were slightly older as well. And surprisingly well, it was a small study. There were more males than females. And in terms of the demographics, in the treatment-naive, there were 5 Caucasians, the lower dose, and 4 Caucasians in the higher dose, and 1 other, which was, I think, a black patient. And in the switch over, there was 4 Caucasians and 1 Asian Pacific. And yeah, in terms of the Jewish Ashkenazi, there was 5 non-Jewish in the treatment-naive, which it is obviously showing that it is in all populations now. And in the higher dose, there were 2 Jewish Ashkenazis and 3 non-Jewish. And then the switch over, there were mainly there was non-Jewish. And in terms of the characteristics, obviously we know that Gaucher disease presents with massive splenomegalies, and in terms of the mean volumes, most of them had bigger spleens than livers. And in terms of the means, it was in the Taliglucerase, the first lower dose, it was 23.9 mean volumes. And in the switchovers, you can see that they were already on treatment and they had responded. Their spleens were actually smaller. The liver volumes also were, the means were 1.9 and 2.2, and pretty much lower in the switchover. The platelets, again, they didn't have massive thrombocytopenia. If you look at the ranges in the lower dose, yeah, and then the chitotriosidase, which is actually a biomarker that we use for Gaucher disease, was obviously very high in both the treatment-naive patients, but in the switchover, you can see that it has come down quite a bit. The CCL18 as well was quite high in the low dose and the high dose, and in the switchover, you can see that there was a nice response. This is just a graph showing the spleen volumes, and you can see that within the 3 years, there were good responses to the mean splenic volume sizes, and in both the naive and the switchover, there was a response, but albeit slower than and the same thing for the liver volume patients. It was a nice result in terms of the response. The hemoglobin level in the naive patients, you can see a nice climb. The lowest we can see is 8, and then responding nicely to 14. And in the switchover, most of them already had a good response. Am I going the wrong way? And in the chitotriosidase values, you can see that, again, they had a good response in the naive patients, and the switch patients also had a good response, but the best results were seen in the naive patients. In terms of the other biomarker, CCL18, also a good response that we could and this is just a patient that we had. You can see that many of the patients in the developed world actually present to us late. They have abdominal distension, they have failure to thrive, they basically, because the spleen is so big, they can't grow, the metabolic rate is quite high. So you see this child at baseline, the height standard deviation increased from approximately minus 4.39 at baseline to minus 2.68 at the end of 3 years, a gain of actually 22 centimeters. And similarly, the weight increased approximately from minus 3.63 to minus 2.83, still below, but a gain of 6 kgs over the last 3 years. And you can see the graphs, and basically we got permission from the parents' patients to show these photos. And in terms of, funnily, in terms of the adverse effects, there were really, really not much, and we know with imiglucerase as well, there was not much side effects. The commonest ones were the mild or the moderate, obviously, and it was upper respiratory tract infections, cough, headaches, abdominal pains, diarrhea. nasopharyngitis. And what is funny is there was dengue fever as well. And basically, it was one patient from South Africa that traveled to Thailand that got it, and I think 2 patients that lived in a dengue endemic area. And only 1 patient had a treatment-related adverse effect, and that was tenderness at a drip site, at a tissue drip site. And the 1 patient that had dengue fever had to be hospitalized because the patient had severe thrombocytopenia in addition to the Gaucher disease. So just in summary and conclusions, the long-term results for Taliglucerase alpha treatment in pediatric patients showed a continuous improvement in visceral and hematological disease parameters and in biomarkers in treatment-naive patients. So it worked for both, and also there was a disease stability in patients who switched from imiglucerase to taliglucerase. It showed that the treatment was well tolerated, with most of the adverse effects mild to moderate in intensity, and almost all adverse effects were not related to treatment. And we obviously were able to extend the Taliglucerase alpha clinical safety and efficacy data set in pediatric patients, and we were able to extend the results of the first Gaucher disease ERT clinical study that focused solely in the pediatric population. I'd like to thank the patients, their families, and the clinical research personnel, and would like to thank Peloton for the editorial and medical writing support, and it was funded by Pfizer. Thank you.